Okay, so good afternoon once again.
Good afternoon, sister.
And how are you guys doing?
We are fine, thank you.
Yeah, it's another Friday. And we thank God for this Friday. I think we'll have to hold on for some few minutes. It's now exactly 3. So let's hold on for some few minutes for others to join so that we can quickly start what we want to look at today. But before we look at today, what we are going to do, last week we started introducing the whole topic of pediatric nursing, where we got to understand that when we say pediatric nursing, that we are looking at the nursing care of a child, the nursing care of a child. And then we try to explain who a child is. And by WHO standards, we got to understand that a child is any individual who is below 12 years. And we also got to understand that the definition for who a child is can vary from one context to the other. Sometimes even from cultural context to social context, educational context, legal context, and we can go on and on. It may vary, but per the WHO definition, a child is any individual who is below the age of 12 years old. And we also got to understand that there are several aspects of the pediatric population. We can have pediatric medicine, pediatric oncology, pediatric pharmacology, pediatric psychiatry, pediatric sociology, pediatric spirituality, and it can go on and on. The fact that that area of study is looking at someone who is below the age of 12 years, then we are looking at pediatrics. Then we also got to understand why it is important to study pediatric nursing. The fact that nursing is currently moving into specialty. And so most of the time, we just don't want you to say you are a general nurse. We wish you say you were a pediatric nurse. And so specialization is coming in. We also got to understand that the pediatric population is quite a vulnerable one, in the sense that in this population, decisions are made. And when decisions are not made well, it goes a long way to affect the period of adulthood of that individual. And so it is always also important to look at the child so that right decisions are made, and then we can expect that in adulthood, we are going to get things right. So these were some of the things we talked about last week. I don't know if anyone has any contribution, questions, or concerns. That will wish. Please, can you hear me?
Yes,
Yes,
please.
please. Yeah, that will wish us to, try and explain before we delve into today's topic. So any contribution, any concerns, questions, things that you want any clarification before we look at today's topic. So we are still waiting. We are still in the waiting period. As we allow others to join, we can have these discussions before the others come. Thank you.